Hello everyone, I'm Dr. Toni Choueiri from the Dana-Farber Cancer Institute. It was really our pleasure on behalf of all the co-authors to analyze the ctDNA in all the participants with renal cell cancer treated with adjuvant pembrolizumab in the KEYNOTE-564 trial. KEYNOTE-564 trial is the trial that led to the approval of pembrolizumab as the first immunotherapy to decrease the risk of recurrence and prolonged survival in renal cell cancer. This was approved several years ago. But here one of the exploratory endpoint was the association of baseline ctDNA metric and the dynamic of ctDNA from cycle 1 to cycle 5 with the primary outcome, which is disease-free survival. Most important thing here, first of all, the majority of patients had ctDNA test that was done. However, what we found, using the 16-plex or the 64-plex test post-surgery, that the rate of ctDNA positivity was very low, less than 10%. Actually, it was around 5% in the 16-plex. Obviously higher in the high risk and M1 NED, and even lower, 4% for example in the intermediate high risk group. We also found that disease-free survival by baseline ctDNA suggests that a positivity for a ctDNA is associated with worse disease-free survival. And the clearance at cycle 5, day 1, compared to baseline was higher, and this is no surprise, in the active arm of pembrolizumab. So overall, the fact that we find less than 10% of patients, even using the 64-plex, finding positive ctDNA post-surgery, do not really, in my opinion, support the routine use of the ctDNA, the current technology, to select patients for increased risk of recurrence post-nephrectomy for adjuvant, pembrolizumab. As a reminder, also, we used Natera's 64 and 16 plex tissue. It's a bespoke assay that is tissue exome based.